Having some swelling, trouble breathing, and fatigue? Perhaps not done as much exercise and healthy eating in your life as you should have? Today, we will be talking about heart failure, a condition that affects millions of people worldwide.
It's Doctora Victoria and George.
Heart failure occurs when the heart does not pump blood as well as it should, causing fluid buildup in the body and organs not receiving enough blood. At first, you may not experience any symptoms, but as the condition worsens, you may feel lightheaded or dizzy or have difficulty breathing, experience a racing heartbeat and swelling in your feet and ankles and legs. But keep in mind, there can be other reasons for this, so if it is new, make sure you seek out some medical attention to find out if it's heart failure or something else. If you are worried, make sure to seek out your friendly neighborhood doctor. They may perform an electrocardiogram, that's all the little probes all over, also called an EKG, a blood test, chest x-ray, echocardiogram, that's the ultrasound, stress test, or a cardiac catheterization to determine your diagnosis. In addition to seeking medical attention, there are things you can do at home to protect your heart. Take your prescribed medications every day, even if you feel well. These medicines help you feel better and live longer, but they only work if you take them as your doctor tells you to. Watch for changes in your symptoms and follow your action plan. An action plan is a list of instructions on what to do if your symptoms change. To use an action plan, you must watch your symptoms closely and weigh yourself every day. If your symptoms get worse or if you gain weight suddenly, take action by checking your plan. A common part of action plans, for example, is by watching your weight. If you gain a few pounds, an extra dose of a medication called furosemide or Lasix can help folks pee off that extra water retention. But make sure you weigh yourself every morning after you urinate, but before you eat breakfast. Wear the same amount of clothing each time and write down your weight every day on a calendar. Call your doctor or nurse if your weight goes up by 2 or more pounds. That's 1 kilogram in one day, or 4 or more pounds, 2 kilograms in 1 week. Sudden weight gain is a sign that your body could be holding on to too much fluid, and you may need a change in your medications. Salt, it's a touchy subject, and when looking at ingredient lists, it will be called sodium on packages. Cut down on salt and avoid adding salt at the table or when you cook. Avoid foods that come in boxes and cans unless their labels say they are low in sodium. The best choices for food are fresh or fresh frozen foods, and foods you prepare yourself. Ask your doctor how much salt you should have and whether you should limit the amount of fluids you drink. If you are overweight, losing weight can help tremendously to help your heart work less hard and keep up with your body's needs. Smoking, bad news bears. It worsens heart failure and increases the chances that you will have a heart attack or stroke or die. It's essential to quit smoking. If you need some help with that, well, George, he already quit smoking here. And that nicotine, it constricts your blood vessels, making it harder for your heart to pump blood. So even if you're getting this through cigarettes, cigars, or vaping, they're all bad news. Alcohol is not so safe for your heart health, so avoid drinking it. There is evidence that 1 glass of red wine can be good for you, but most patients, in my experience, have a hard time stopping at just 1, so it can be better to avoid. Thank you for joining us today on our healthcare team. We hope you'll join us next time. Bye-bye.